Hi, my name is Leland Cheung. I'm a level 2 Master Nursing student, and this is my injections video. So in order to administer a safe injection, the first thing I'm going to be doing is comparing the order to the EMR, which will be given at St. Joe's. I need to confirm the eight rights of medication administration, which are right patient, right medication, right dose, right route, right time, right documentation, right position, and right to refuse. I'm going to be checking the patient's allergies. In this case, Mr. Mancini is allergic to codeine, so that would be taken into account. I would be assessing the medication and health history of Mr. Mancini as well to see if there's any contraindications of the medication and or injections. In assessing my patient's body build and muscle size and weight, so if the patient is obese, then I'll be using either a longer needle or I'll be using special techniques such as pinching the skin in order to give the injection. For thin people, for thin populations, I'll be using a shorter needle. And for people with not as developed muscles, I won't be using an IM in their deltoid region. I'll be using it in a different region. Okay, so for this injection, for the heparin, the sub-Q injection, I'll be using this needle. So it's the 0.5 millimeter gauge with a 16 millimeter length, and that's fine for the sub-Q because the sub-Q is ranging from 9.5 millimeter length to 16, and the gauge would be 0.5 to 0.4, so this would be fine. And for the intramuscular, the needle will be 0.7 millimeters to 25 millimeters because the range is from 25 millimeters to 38 millimeters for length and also 9.5 millimeters to 0.5 millimeters for the gauge. So this is also in the right range. And for both injections, because the heparin is 1 milliliter and the Haldol is 0.5 milliliters, I'll be using the 1 milliliter syringe in order to ensure that I'm as accurate as possible. Alright, so first I'll start by using doing hand hygiene. In reality, I'll be using actual hand sanitizer in order to have effective hand hygiene. And so now I'm going to start by opening the vial safely. Oop. So in reality, I've already opened it, but I would flick it off like this, and so like that. Then I would open this alcohol swab, like so, and I would use the alcohol swab going from the inner to the outer, ensuring that it is clean. And I would be taking the syringe, and I will be taking the needle, screwing on the needle. Then I will be taking back the shield lock, taking off the cap. I'm going to aspirate air throughout the syringe to ensure that it works properly, as it does. And so since I'll be doing the heparin injection, I'll be doing 1 ml. So I'm going to aspirate air up until 1 ml. There we go. And then, so I'll be taking it like a dart. I'll be holding the ampule on the ground. I'm just going to go straight in. And then inject air into air, like so. I'm going to flip it over and aspirate liquid. Alright. So it's all the way up until 1. Now I'm going to be just flicking. And okay, so now I'll be aspirating air back into air to get rid of the air bubble. Okay, and then I'll just be aspirating the rest of the 1 ml because of the liquid that I have expelled. Right. There we go. Alright, so that's fine. So I'm going to turn it back over, take it out, and put it back into the cap. There we go. And also lower lock. There we go. And just lock. And then I'll be writing down the patient's room number, so 701, room 701, bed 1, Mr. Mancini, Mario, the date, which is January 15th, 2017, and yeah, so that's it. Oh, and my initials as well. So, all right. Alright, so I'll be, before I start the intramuscular injection preparation, I'm going to be taking my garbage from the previous subcutaneous injection and just putting it in the trash, because it does not need to be in the sharps container. Alright, so first I'm going to start by viewing the ampule, making sure that none of the liquid is in the neck, and then I'm going to be taking an alcohol swab and just making sure that I put it around it while I break it. So 1, 2, 3, there we go. And so that I will dispose of in the sharps container. We don't have one right now, but in the clinical setting, I will have put it in the in the sharps container. Right. So now I'll be putting together the needle. So I'm going to take my syringe, lock it onto the needle. I'm going to put this back. Take the cap. Remove the cap. Okay, and then I'll just be inserting it into the vial without touching. And you don't need to aspirate for this one because it is an ampule with an open system ampule. And so I'll be withdrawing the fluid, injecting it into the air. Alright, so now that the air bubble is gone, I'll be putting it back in to the vial and expelling the rest of the liquid until it's 0.5 milliliters. Yep. So I checked it over, and so now I'm just going to be replacing it into the cap and re-putting the shield on. I'm going to be putting it into the paper and writing the room number 701, bed 1, Mr. Mancini, Mario, January 15th, 2017, and my initials. And I will also be putting this vial in the sharps container. Alright, so in order to start the actual injection, I will first be doing hand hygiene. Again, with real hand sanitizer in the clinical placements. Alright. And then I will be donning my gloves. And then I will walk into my patient's room with the needle. And so first I'll confirm patient identification using 2 identifiers. So I'll say, hi, hello, Mr. Mancini, can you give me your full name, please, and your date of birth? And then I'll also ask for his allergies, in which case he will say codeine. And I will check this over with his wristband and also with the information that I already had on his order. I will also be explaining the procedure to the client. I will be saying, okay, so Mr. Mancini, we're going to be doing your subcutaneous heparin and also your intramuscular Haldol today. So for your subcutaneous heparin, we'll be injecting it into your abdomen, and also for your intramuscular Haldol, we'll be injecting it into your deltoid. Okay, so for the subcutaneous injection, first I will begin by taking the alcohol swab and swabbing. After landmarking, I will swab from the inside out to cleanse. So I'm just going to let that dry, so then there's no alcohol going into the wound, into the injection site. So I'll be taking the needle, taking the shield off, removing the cap, and I'll be going in at a 45-degree angle, but first I'm going to pinch because this is the technique that is used for subcutaneous. And I'll just be going into the injection site, like that, taking this. And originally I would have the gauze in my, between my 3rd and 4th finger, and I will be slowly injecting the fluid. Then when I'm done, I will be putting the gauze that would be there, and then slowly removing the needle and asking them to hold it. And then I would put this back into the cap and would put the whole needle into the sharps bin. Okay, so for the IM injection, I will start by taking the alcohol swab again, taking the, going from the inside to the out, this time on the deltoid. So I'll allow that to dry as well. I'll be taking the needle out, retracting the shield, and taking off the cap. Okay, and then so first, I will use the Z-track method after putting this in my fingers. So Z-track method like that, like so. It would be easier on a person and I wouldn't have to use my other hand to hold. And then so, going at it at a 90-degree angle, like so. And so first I will aspirate to see if there's any blood. So there's no blood, so I have not hit a vessel, so it is in the muscle. So I'm safe, and I go in, injecting the fluid a little bit at a time. 1, 2, 3, 4, 5, 6. Alright. So now I'm just going to hold it here for 10 seconds. Okay, and then I'm going to be taking the needle out slowly and retracting my hand, so then the Z-track is closes off the muscle and keeps the injection fluid inside. And then I'll be putting the shield up, over, and I'll be putting that in the sharp spin. For the last subcutaneous injection, I should not have put the cap back on. I should have just put it straight into the sharp spin. Alright, so in order to document, I will document that I gave the injections safely and that I followed the 8 rights of medication administration, that I gave the right dose, the right route, and I would write down the time, and I would also initial my name, and I would also show that the response that the patient had was normal after I check up on them later, and that there were no complications at all. And if the injection was not to be done for any reason, I would write down, I would document why that was so, and what I did to resolve that.